Welcome to the annual Bloodborne Pathogens training for the staff of Newton Falls Schools. This annual training is mandated by OSHA, which stipulates that schools are responsible for identifying and educating staff who could be reasonably anticipated as a result of performing their job duties to be in contact with bloodborne pathogens. Bloodborne pathogens can be defined as viruses, bacteria, or other microorganisms that are carried in the bloodstream and can cause disease. The bloodborne pathogens most commonly encountered in the school environment are Hepatitis B, Hepatitis C, and HIV. Hepatitis B is an inflammation of the liver which can lead to cirrhosis or liver cancer. It is the most infective bloodborne disease. Particularly concerning is the fact that the virus can survive outside of the body for up to a week. The good news is that there is a very safe and effective vaccine that all employees are eligible to receive. The Hepatitis B vaccine is a series of 3 shots administered over a 7-month period. Nearly all school staff are considered at risk and are eligible for the vaccine at no cost to the employee. Hepatitis C is mostly linked to the use of illegal drugs. It has the highest mortality rate of all forms of hepatitis. Fortunately, it does not survive well outside of the human body. Although there are treatments for hepatitis C, there is no vaccine to prevent it. HIV attacks the immune system and can lead to AIDS. It is not spread by casual contact such as hugging or shaking hands. HIV is fragile and does not survive well outside of the human body. It is most commonly spread by unprotected sex or sharing needles. Improved treatments have led to decreased mortality in recent years. So how do bloodborne pathogens enter your body? They enter through direct contact with blood or other potentially infectious materials, through open cuts, wounds, skin abrasions, or by splashing into the mucous membranes of your eyes, nose, or mouth. An exposure incident occurs when there is exposure to blood or other potentially infectious material and an entrance into the body. Each school district is required to have an exposure control plan that is accessible to employees. This plan must identify staff members and tasks that increase the risk of exposure and delineate the district's vaccination program. In addition, it identifies work practice controls to reduce risk and the appropriate use of personal protective equipment. It also explains the procedure for reporting an exposure incident. Copies of our district's exposure control plan are available in each of the school offices and in the clinic. The terms universal or standard precautions are interchangeable and are defined as the practice of treating all human blood and body fluids as potentially infectious. This practice reduces the spread of disease through both recognized and unrecognized sources. Remember, everyone has something you don't want. You universally treat everyone the same. Universal precautions apply when there is possible contact with blood or other potentially infectious material. Bloodborne diseases are not communicable through exposure to feces, urine, sweat, nasal secretions, or vomit unless blood is visible. However, because of potential exposure to other disease-causing organisms, universal precautions should still be practiced. Hand washing is the single most effective means of reducing risk of transmission of infectious diseases. Hands should always be washed before eating and after any contact with blood, body fluids, or soiled objects, after removing gloves, after using the restroom, and after assisting a student with personal hygiene. Alcohol-based hand sanitizers are recommended for use when soap and water are not available. However, you need to wash your hands with soap and water as soon as you have access. Personal protective equipment is defined as specialized clothing or equipment that provides protection against infectious material. Personal protective equipment includes gloves, gowns, eye protection, and resuscitation devices. All contaminated personal protective equipment must be removed and properly disposed of when leaving the area of exposure. Gloves are available from the nurse. Always wear gloves if you anticipate contact with blood or other potentially infectious materials. Make sure gloves are intact. Be careful not to touch the contaminated surface of gloves when removing them. Always wash your hands after removing gloves. Biohazard waste containers are located in each clinic. These cans are lined with red biohazard bags and are for disposal of materials contaminated with moderate to large amounts of blood or other potentially infectious materials. Objects contaminated with small amounts of blood can be disposed of in the regular trash. If an incident occurs in your classroom, make sure to use personal protective equipment as needed. Isolate the contaminated area, keeping students away. Contact the office to have the custodian disinfect the area. Staff members that are responsible for cleaning up blood spills should make sure to follow these steps. Apply gloves. Absorb as much of the spill as possible. Apply 10% bleach solution or other approved disinfectant. Bleach solutions will need to sit on the surface for 15 minutes before being wiped away. Follow directions on other approved disinfectants. Remember, an exposure incident only occurs if blood or other potentially infectious material has come into your body through non-intact skin or mucous membranes. If an exposure incident occurs, first, wash the exposed area with soap and water, or flush the area with water if it involves the nose, mouth, or eyes. Next, report the incident to your immediate supervisor and the nurse. You will need to see your physician for further testing and treatment. This concludes the Bloodborne Pathogens presentation. Please proceed to the quiz associated with this program. See Mrs. Noski if you have any questions. Thank you.